Welcome, everyone. Thank you for joining the Medicare 101 webinar today. I'm going to give it about 15 to 20 seconds while we wait for the final people to finish getting logged in and their screen loaded up. But while we're waiting on that, I wanted to draw your attention to the puzzle that I've got on this page here, a picture of your Medicare card with some missing puzzle pieces. And that's what I hope to accomplish on today's webinar. Probably take us the next 35 to 40 minutes to cover everything, but we hope to be able to put your puzzle pieces back in place so that as we go through this, you're completing the picture of what Medicare is going to look like for you and hopefully answer a lot of your questions. So without further ado, let's just jump right on into the start of the presentation. First, who was my Medigap consultant? We're an independent brokerage firm. We represent multiple carriers across all Medicare products, whether it's Medicare supplement plans, Medicare Advantage plans, cancer, heart attack, and stroke. You name it, we have it. We take an educational approach to Medicare. That's why you're here today, right? You want to be educated on what your options are, how Medicare works. My philosophy has always been an educated client is the best client. It does me no good to help someone enroll in a plan that they have no idea how it works, what their limitations are, what their pros and cons are of each plan. So we really want to dive into education first before we get into any type of plan designs that works best for you. Hopefully you're going to see that I'm a very laid back. I'm from the South. I'm in North Carolina. Zero high pressure tactics from me. I will never tell you that you must enroll in this plan. Got to get it today. I can't stand that myself. I don't even consider myself a salesman. I just love Medicare and I love talking about the options and helping people come up with the solutions to those options. I've been in this Medicare space since 2008. So I'm finishing up my 18th year, I guess. And during that journey, I've helped thousands of people just like yourself transition over into Medicare. And hopefully I'm going to be able to help you with that as well. So a little bit more about myself. I am married to my wife, Pam. We've been married for 24 years, going on 24 years, and we have an amazing 17-year-old daughter. Her name is Laurel, and we've got two dogs. Lexi is this one here, the little older one, and Gracie is about 6 years old. She's my arch nemesis. The dog hates me. I love her, but she is my wife's dog. Was originally a COVID dog for my daughter when she was like 12 at the time, but my wife pretty much takes care of that one. As I mentioned before, I've been in the Medicare market since 2008. I'm a proud Clemson graduate, was a textile management major, worked in the textile field as a process and quality engineer for a little over 10 years. And then I jumped out of that to try to find different avenues of what would help fulfill my life. It just wasn't going where I wanted to go. As you can see from the pictures, my daughter is an equestrian, and so she loves the horses and jumping. In fact, she's on an IEA team. It's a team sport for equestrians at the high school level. Not her particular high school, but she rides for a barn, and they recently won the national championship for IEA. So very proud of that. And so we go all over the Southeast with her equestrian events. And so anyway, other things about me, I love being outdoors, whether it's golfing, biking, riding, working out in the yard, just trying to stay active. And so that's, again, a little bit of information about me. And hopefully if you decide you want to work with me and we do a one-on-one consultation, I get to learn a little bit more about yourself and what your situation is. So let's just jump right into it. If you look at the rear view mirror picture, I've got objects and mirror are closer than they appear. That's sort of what we think about Medicare. Whether you're 8 months away or 3 months away, it is coming up on you fast. So what we're going to cover today is how to enroll in Medicare. Do you need to enroll in Medicare? What are the basics of Medicare? What are supplement plans versus Medicare Advantage plans? What isn't covered by Medicare and how to fix that? Let's get some maximum protection in there for you. What is Medicare drug coverage? How does that look? How are we going to help with that? And then at the end, we're going to put all those pieces together for you. So hopefully your puzzle piece will be put together by the end of this presentation. All right, so let's look at a couple different enrollment scenarios. If you're already drawing Social Security, you are automatically enrolled in Medicare, both A and B. So you don't need to do anything. Just sit back, continue to take notes on this presentation so you'll know what options you have, but you do not need to take any steps on enrolling in Medicare. That is automatic for you. You should receive that card within 3 to 4 months of your birth month. Okay, so if you're not taking Social Security, you will need to take some action. Next slide, we're going to cover that. Maybe you're working past 65, or you're a spouse with someone that is still working and covered on employer coverage. Do you need to enroll in Medicare? That's another question that needs to be answered, and we oftentimes compare your employer plan to what Medicare has to offer, and is it better to stay on the employer plan or go on to Medicare? So we can help guide you in that direction, whether it's making a recommendation to stay on that employer coverage and delay Medicare, but we'll want to walk through those scenarios with you. And then also, finally, maybe you have veteran coverage. Maybe you have VA or TRICARE for life. You know, what happens with that? Do you need to enroll in Medicare? Are you on the federal employer plan, or do you have Medicaid? So again, those are different situations that we would want to address on a more one-on-one basis and let you know what options you have there. All right, so let's go under the assumption that you are now retired and going on or eligible for Medicare in the coming months, but you're not yet taking Social Security, because this is the one you're going to have to take action on. This is the one we find most of the people are in this situation. So Medicare is going to start on the first of your birth month. So if you're born between, I'm going to use April as an example because it's easy math for me, April 2nd towards the end or through the end of the month, Medicare is going to start April 1st. Now your enrollment window opens 3 months before your birth month. So January 1st through the end. So you got January, February, and March through the end of March. If you apply during that time, Medicare will start April 1st. And then if you apply after, it always starts the first of the next month. So if you apply in May, Medicare Part B is going to start on June 1st. Okay. And you can go up to 3 months past your birth month. But most people will want to get that done 3 months prior to their birth month, or within that 3-month period, so that it starts on their birth month. Now, there's one exception. If you are a first of the month baby, your Medicare starts 1 month earlier. So if you have an April 1st birthday, Medicare will start March 1st, and your enrollment period begins December 1st. Why does Medicare do that? I have no idea. One of the weird quirks of Medicare. So if you are that situation where you have a first of the month birthday, it starts the month before. Okay, so make sure you don't miss that window. All right, so let's just jump right into Medicare. What is original Medicare? You see the Medicare card up here. You'll receive this, again, 3 to 4 months prior to your birth month if you are receiving Social Security. And it will have your effective dates on here, your Medicare number, and your name. So Medicare Part A and Part B, the two of those are what makes up original Medicare. Okay, so under Medicare Part A, that is your hospital coverage. Most people that have, or anyone that has worked 10 years and paid or 40 quarters into the Medicare and paid into the Medicare system through payroll, then your Part A has no cost. So that's going to be the majority of people that are eligible for Medicare are going to pay zero premium for Part A. Under Part B, though, there is a premium. So I may be the bearer of bad news. Yes, you have paid into the Medicare system, but Medicare is not free. That is a big misconception. Part A has no cost, but Part B, for most people, is going to be $202.90 for 2026. That can adjust each year. This can be higher if you're in a higher income bracket. So you see down below, between 109,000 and higher for a single tax filer, 218,000 or higher for a couple filing jointly, you pay a higher premium than the 202.90. So make note on your notes, if you're taking some notes on what your situation is, so that if we do have a one-on-one consultation, we'll be sure to cover what your specific situation is. So again, Medicare Part A is going to cover you for hospitalization, but there's a lot of holes in both A and B that you need to be aware of. So with Part A, there is a deductible, $1,736 deductible for inpatient coverage. That covers you for the first 60 days of hospitalization. You can still have some Part B claims while in the hospital because you got surgeon fees and things of that nature. But $1,736 is going to be basically your room and board. Now that is not an annual deductible. That's per incident. So if you're hospitalized after that 60-day window has ended, for the second time, you've got another $1,736 deductible. So for instance, you're hospitalized in January, you're treated and released after 4 or 5 days, you got a $1,736 deductible. You go back into the hospital in June, you've got another $1,736 deductible. So it's not an annual deductible like you're probably used to. Now, if you're in an unfortunate situation and you're in the hospital for more than 60-day period, it jumps up to $434 per day for days 61 through 90. And then the next 60 days after day 90, from 91 through 150, it doubles to $868. You can do that math. That is a lot of money that you're exposed to with just A and B. Your skilled nursing care. So after you're released from this hospital, they put you in a skilled nursing facility for rehab. Your first 20 days are at no cost under original Medicare. Then the next 80 days is $217 per day. So again, you can see the huge exposure and liabilities that you have with just Part A. Now your Part B works in conjunction with A, but this is your outpatient coverage, your doctor visits, your diagnostic tests, MRI, CT scans, specialist visits, durable medical equipment, outpatient surgery, chemotherapy treatment's a big one, dialysis if you have end-stage renal disease. All that is going to be covered under Part B. Now, Part B does have an annual deductible, which is $283. But once that deductible is met, you notice here that Medicare is going to pay 80% and you're responsible for 20%. Very similar like what you've had on employer coverage, probably an 80-20 plan. However, that 20% that you're responsible for, there is no limit on it. There's no cap on what you're exposed to. So let's use cancer, for instance. If you're going through chemo treatment and you're paying 20% of that chemo bill, and let's say it's $100,000, you owe $20,000 for that. All right, so as you can see, with just A and B, it is not recommended that you just have Medicare A and B only. So what do we do about that? So there's really two choices people choose once they go on to Medicare. You either stay with original Medicare A and B, which keeps Medicare as your primary insurance, and then you would want to supplement it to cover those gaps that we just went over. So a supplement plan is going to fill in and pay those deductibles, copays, and coinsurances that we just looked at, the majority of them. Medicare does not cover prescription drugs, so you would also need to add a Part D drug plan if you go with this option here. The second option that people choose is what's known as a Medicare Advantage plan. Most oftentimes referred to as Part C, but usually people are going to say, I have a Medicare Advantage plan. They're not going to say I have a Part C plan, but it is Part C. It is administered by individual insurance carriers, and we're going to talk about each of these options in a little bit more detail on the next few slides. So let's just dive right into Medicare with a supplement plan and how that supplement plan works for Medicare. We've already talked about Medicare and the A and the B and the exposures that you have. So a supplement plan, think of that as a secondary policy to Medicare. Supplement plans are what's called standardized plans. This excerpt is taken directly from the Choosing a Medigap policy that the Centers for Medicare and Medicaid Services put out each year. And in the book, it states all Medigap policies are standardized. This means policies with the same letter offer the same basic benefits no matter where you live or which insurance company you buy the plan from. So essentially that means Plan G is Plan G, Plan N is Plan N, Plan L is Plan L, and so on. There's 10 different Medigap plans to choose from. 99% of people choosing a supplement plan are either going to have Plan G or Plan N. Plan F and C are no longer available to people turning 65 after 2020. But so G and N are the two dominant plans now. And as you look at this with Plan G, here's your basic benefits of original Medicare, that A and B, those exposures that we just talked about. And this chart is found in the Choosing a Medigap booklet as well. But you'll see that under Plan G, you have 100% coverage all the way down, with the exception of your Part B deductible. Remember, that was $283. So when you have Medicare A and B and you pair a Plan G with it, you pay your $283 deductible. After that, you have 100% medical coverage for the rest of the calendar year. Plan N is going to work very similar. You have 100% all the way down, with the exception of the Part B deductible of $283. Potentially, you could see some excess charges, and we'll look at that there. And you got 3 little stars here, so you've got a little bit of copays with Plan N. So let's look at these two side by side. So both Plan G and Plan N, as I mentioned, 99% of people that choose a supplemental coverage will be on either G or N. Prices are going to range. It really depends on your zip code. If you're in Texas, for instance, Houston is going to be more expensive than San Antonio. Houston's probably Houston area is the highest priced area in Texas, and then San Antonio, Dallas, a little bit cheaper. So I'd say Houston's probably 20 to 30% more in monthly premium. And so you can see how it ranges within a state. And for instance, I'm in North Carolina. North Carolina, the entire state's the same. For most carriers, one rate throughout the whole state is going to be pretty consistent. But Plan G is going to typically run between $100 to $175, again, depending on where you are. Also, what gender you are, male or female. Females will be a little bit less than men. And again, with Plan G, all you're responsible for is that $283 deductible. Then between Medicare and Plan G, you have 100% medical coverage. Now with Plan N, you notice here your premium savings is a little bit lower, roughly between $80 to $135. Again, that's just a ballpark, but usually we see Plan N's priced about 20 to 25% less than Plan G, and you still pay that Part B deductible. Once that deductible is met, you'd have copays for doctor visits of up to $20, up to $50 for the emergency room, and you could potentially see excess charges. Excess charges are not common, but if you do choose Plan N, we need to know what those are. So an excess charge is when a Medicare provider, so 98% of all providers throughout the country takes original Medicare. Of those 98%, over 95% accepts Medicare assignment. So if they do not accept Medicare assignment, then they can charge an excess charge. And that excess charge would be they can charge up to 15% more than the Medicare allowed amount. But if they accept assignment, they cannot charge excess charges. Okay, so the point being is 95% of providers accepts Medicare assignment, therefore they cannot charge an excess charge. So your chances of ever seeing an excess charge are pretty low, but again, you need to know what they are. And we can always check certain providers on Medicare's website to see if they take assignment, but again, typically that is not an issue. And even on ones that I have seen excess charges, the charges are minimal. So not a real big concern. Now, if you do choose Medicare, staying with Medicare and supplementing it with a Medigap plan, you need to choose a Part D drug plan. Drug plans are going to vary from area to area as well. Again, it's all based on your zip code. Most plans are going to cover thousands of medications. We want to choose the plan that covers your specific medications the best. Each carrier is going to have those formularies. They're going to be broken down as Tier 1s, which would be your basic generics, all the way up to your Tier 5s, which might be like Skyrizi. You see commercials for Skyrizi often. That's a $20,000 a month prescription. All drug plans have different phases. You got a deductible stage, coverage phase, and catastrophic phase. So once you hit the catastrophic phase, which means you have spent, or Medicare says you have spent $2,100 in drug costs, then you have 100% drug coverage after that. So that person that takes Skyrizi each month will hit that $2,100 cap really fast, and then the rest of the year they'll have 100% medical coverage. So the most they'd spend for that would be $2,100. There are penalties if you decide to go without drug coverage. So I don't recommend ever going without drug coverage, and you just never know when you might need something. That Skyrizi is an example of a super expensive medication, but you just never know what the good Lord has in store for us. You could find yourself in the middle of the year, you have a mini stroke, and now all of a sudden you have to be on Eliquis for the rest of your life. Eliquis is now about $300, $250 a month. It used to be $500, but that's part of the new administration where they reduced some of the drug costs for those top 10 drugs. But anyway, you don't want to pay $300 a month for the rest of the year but you would if you didn't have drug coverage. So if you don't take any medications, just get on the lowest price drug plan. And again, we're going to walk you through that. And the way we walk you through your drug coverage is Medicare's Plan Finder tool. Very simple to use. We plug in your medications, plug in your preferred pharmacy, your zip code, and it's going to tell us exactly which plan is going to give you the best coverage. But not only are we going to do that, we're going to look at some of your specific medications, because although some of those might be generic, there's still a lot of generics that are tiers 3 and 4 that might be $80 or $90 on a drug plan, and we can hopefully find some alternatives where you might be able to get those off of the drug plan, away from using the drug plan, through some of the other discount programs that are out there. So we're always going to look for how you can save the most on all of your Medicare needs, prescription drugs being one of them. All right, so that pretty much summarizes Medicare with a supplement plan. Now we want to do a little deeper dive into what Medicare Advantage plans are. So Medicare Advantage plans take your Medicare Part A and Part B. Okay, so you're still enrolled in Part A and Part B. You still pay that Part B premium. That never goes away. But now you are essentially signing your Medicare rights over to the insurance company. Now they're going to give you a packaged plan known as Part C, aka Medicare Advantage plans. So again, you assign your Medicare rights over to the insurance company. They're going to give you a packaged care plan. Typically, these plans are going to be much lower in premium. Oftentimes, there's zero premium. We'll talk about that on the next slide. But they can do that because these plans are subsidized by the federal government. So the government gives the insurance carrier per member per month a certain dollar amount based on their star rating and performance metrics that they have. And it's a substantial amount per month that they receive. So now they can package this one plan to you at a much lower cost, where now you have some cost sharing built into it. So what's a Medicare Advantage plan going to look like? So again, it's a managed care health plan. It's an all-in-one package that's going to manage your Medicare A and B for you. But being that it's a managed care plan, they often utilize prior authorizations, which means they have to have certain tests and procedures approved before you're eligible to have that done. They're going to be network-based. Remember, Original Medicare is accepted in 98% of all providers throughout the country. Medicare Advantage plans, you have a network, HMO or PPO plans. We are seeing a trend right now, starting this year in 2025. A lot of carriers are eliminating or reducing PPO plans. So there's not as many PPO plans available as there was 2 or 3 years ago. And we see that trend is probably going to continue as they're moving more towards an HMO model with a lot of these, because they can control their cost a lot better on an HMO when they have control of their network. PPO gives you the option to go out of the network on those plans as long as that provider will accept the terms and conditions of it. So carriers have less control on their fees and stuff on a PPO design plan. Most of these plans will cover that Part D drug coverage in there. And as mentioned earlier, you also have a zero premium. I'd say over 50% of Medicare Advantage plans are going to have zero premium. There are some that have, $20, $30, $40, $80 a month premium. But most people will be on a zero premium plan. But don't let that fool you. Just, again, reiterate, you must continue to pay the Part B premium. That never goes away. And then when you're on a Medicare Advantage plan, again, it's going to work a little bit different than Medicare and that supplement. Remember, with the supplement, you just pay the $283 deductible for Part B, and after that, 100% medical coverage with the Plan G. With the Advantage plan, you'd have copays for everything. Copays, deductibles, co-insurances, but you also have that out-of-pocket maximum that's very important. You've got an exposure limit, so to speak, with a Medicare Advantage plan. So unlike Original Medicare, where it's unlimited by itself, an Advantage plan, you do have some cap on what your exposure is, and we'll dive a little deeper to that in a few minutes. But if you do go with an Advantage plan, we're going to highly recommend that you pair that with a secondary policy called a hospital indemnity. If you think about it, you're supplementing Medicare with a supplement plan. There's also another plan that we can use to sort of supplement a Medicare Advantage plan to give you a little bit additional coverage to cover up some of those gaps. All right, so what's the process of choosing a Medicare Advantage plan? Because it's a lot different than choosing a Medicare supplement plan. So in an Advantage plan, we're going to need the zip code of where you live. We're going to need a list of doctors, hospitals, medicines, what's your pharmacy. We're going to plug all that into our software, and we're going to be able to eliminate a lot of plans just based on that information. And the number of plans that are available really is dependent on where you live. So somebody in Houston or Charlotte, North Carolina, there might be 50 or 60 different plans that are available. But if you're in more of a rural area, there might be 5 to 10 plans that are available. But regardless of how many there are, once we plug that information in there, we're going to be able to whittle that down to 2 to 4 different plan options that we would recommend, maybe 5. And then from there, we're going to do a deeper dive into it as to looking into the out-of-pocket maximum. What's your exposure limits on that? What are your copays? What are the extra benefits on the plan, and which one makes the most sense based on the needs analysis that we did with you prior to looking at the plans? Which one's going to make the most sense for you? And then we'll be able to come back with a plan recommendation that will meet what you're looking for. So as you can see, there's a lot of steps going into choosing that Medicare Advantage plan. So just as a side-by-side comparison of the two options, again, both of them, you still pay the $202.90. Premiums are going to be based on your zip code with a Medicare supplement plan. So, a good rule of thumb, $80 to $160 a month, just depending on whether you go with Plan G or Plan N. Most Medicare Advantage plans are going to have no premium. Your coverage, you're going to have the lowest out-of-pocket exposure with Medicare and a supplement plan for your medical costs. All right. With Medicare Advantage plans, you're going to pay less each month because, again, you don't have any premium typically on your Advantage plan, but you do pay as you go for your medical costs. So if you have high medical costs, then you could pay a lot more in your medical care than what you would over here with the supplement plan. With Medicare is your primary insurance and your supplement is secondary. So you can choose any doctor in the country that takes Medicare, any doctor or hospital, and 98% do. No referrals are required. So it's a true freedom of choice over here. You need to see a cancer specialist at MD Anderson, or you want to travel out to California to see the world-renowned heart surgeon. You can do that because you've got original Medicare. You probably would not be able to do that with a Medicare Advantage plan because you need to stay within the network of doctors and providers that are on that plan. So Part D coverage is separate with original Medicare. You need to enroll in a Part D plan, and typically with an Advantage plan, it will be built into it. We've already talked about the exposure on Plan G is $283. So typically with an Advantage plan, if it's an HMO plan, you could have $4,000 to $6,700 is typically the ranges we're going to see as your out-of-pocket exposure on an Advantage plan for an HMO. A PPO could cap out at $10,000. It's usually going to be $7,000 to $11,000 in out-of-pocket exposure, again, just depending on what's available in your area. Now, Advantage plans will have some of those extra benefits, dental, vision, hearing, maybe a gym membership benefit. A lot of that's going to be limited, so we need to look and make sure, that that's going to be pertinent for you and your situation. You will not get that in Medicare with original Medicare and a supplement. There are some policies that you can purchase, obviously, that would cover the dental and vision type coverage. But if I were to compare the two and summarize it in one or two words, Medicare with a supplement is what I would call the Cadillac. When you're simply looking at health insurance coverage, which one gives you the most coverage that you can get? That would certainly be Medicare with a supplement plan, in my opinion. Now, you're paying that monthly premium for it, but you've got the true freedom of choice to see any doctors or providers that you want to. 98% throughout the country, no referrals, no prior authorizations. Really, your health care is between you and your doctor, not you, your doctor, and the insurance company. Medicare Advantage plans makes a lot of sense for a lot of people because it gives them that premium savings. Maybe they only go to the doctor once or twice a year, and they would rather take that premium savings and have the higher exposure. So again, there's no right or wrong way, but if I'm just simply looking at which one gives me the best medical coverage, in my opinion, Medicare with a supplement is probably the best insurance you'll ever have in your life. Now, there's still some other types of plans we need to address and options, because while Medicare and supplemental coverage is great, Medicare Advantage plans are great, they all still have some unseen expenses that you can incur. So we want to look at potentially adding cancer, heart attack, stroke policies, hospital indemnity plans with Medicare Advantage plans, and recovery care or short-term care plans if you do not have a long-term care plan in place. The dental, vision, and hearing is pretty self-explanatory, so I'm not going to go too much into that. But with cancer, heart attack, and stroke, I look at cancer for sure is probably people's biggest expense when it comes to healthcare. Cancer is just a huge expense. Even if you've got Medicare with that Plan G, yes, your medical bills will be great, but there's a lot of other hidden costs when you are taking on some of these conditions, whether it's cancer, heart attack, or stroke, where you need some outside help to come in. Maybe you need to travel to various different doctors that are throughout the state or in another state. And so these types of plans can put cash in your pocket to help offset some of those costs, so you're not having to use your savings or HSA funds if you have HSA money. You're not having to use that, and they're pretty inexpensive to put some of this extra protection in place so that you don't have to use those retirement funds for that. The hospital indemnity plans, this is strictly going to be for people with Medicare Advantage plans. If you think of, again, I think I used the reference earlier, you have a supplement to supplement Medicare. Think of this sort of as a supplement to your Medicare Advantage plans. It's going to fill in the gaps of your copays for hospitalization. So it basically wipes out your cost for hospitalization, outpatient surgery cost, ambulance, ER visits. We can even add a cancer rider to a lot of these plans. So typically a well-built hospital indemnity plan is going to run you probably $1 to $2 per day for a good plan that's going to pretty much mitigate a lot of the gaps that you have in a Medicare Advantage plan. So definitely recommend that this is highly recommended for Medicare Advantage plans. I can't stress the importance of that enough. And then we get back to long-term care. Most people do not have a long-term care plan in place, and they are very expensive now that you're turning or soon to turn 65. Long-term care coverage is extremely expensive and pretty difficult to qualify for because of people's health conditions maybe at that time. There are other policies that are available, a short-term care plan. We've got a couple different carriers that offer this great coverage. It gives you a total of about a year of coverage, typically about 360 days of coverage. Now this would be covering you for, let's use that example of the skilled nursing care. Medicare only covers 100 days. After that 100 days, same thing with the Advantage plans, you only get 100 days of coverage. After 100 days, you are on the hook for 100% of the cost. If you have a Medicare supplement plan, if you have a Medicare Advantage plan, the Advantage plans only cover the first 20 days at no cost, because that's what Medicare says they have to cover. Days 21 through 100, you're going to pay the $217 per day. So we can design these plans to cover that, but also give you the extra days past 100. So if you did have to go to, assisted living for extended care because you still can't perform 2 of the 6 ADLs, you've got a daily benefit amount there that's going to cover that high cost. Gives you basically a year for you and your family to put some action plan in place so that you can buy a little bit of extra time, so to speak, so that you can figure out what needs to be done past that point if you needed extended care past the year. So that brings us to sort of putting together a package for what's best for each person. So we got 3 different packages that we recommend, going from gold, silver, down to bronze. So somebody that's a Medigap type person, Medicare with a supplement plan, The gold package, we would look at a cancer, heart attack, and stroke, dental, vision, and hearing, and a recovery care plan. That type of policy would give you maximum coverage and protection. The silver plan may include cancer, may add the heart attack and stroke to it, dental and vision, or the bronze plan with just cancer and heart attack and stroke policy in addition to Medicare and your supplement plan. So if you want to take a picture of this page or jot down on your notes which one might feel like best option for you. Same thing with the Medicare Advantage side. We always recommend a package for that additional cover to help fill in those unforeseen gaps. Certainly with an Advantage plan, the hospital indemnity plan is a no-brainer, in my opinion, to cover those bigger gaps that you have. Cancer, cannot stress enough that 20% co-insurance that you have on an Advantage plan. You will max out your Advantage plan within a month or two in your out-of-pocket cost if you go through cancer treatment. So very important to add cancer coverage there as well. And then again, going back to the short term, if you do not have a long-term care policy in place, adding that short-term care or even a home health care policy. So we've got a couple different options that we can look at to fit a person's needs. All right, so here's just a list of some of the companies that we work with. Again, we are an independent brokerage firm. We don't just represent one carrier. We have over 25 different carriers across the board that we're licensed and contracted with. So we can bring to the table all options to you to make sure that you're on the best plan with the best carrier that works best for you. All right, and just to sort of we're getting to wrapping this up, so we're almost towards the end. So I just wanted to cover some questions that you might have or you might have had in the past and just address some of those at this point. A lot of people ask, what does it cost to work with someone like you? It doesn't cost you anything. Think about it like your home and auto insurance. You don't pay them a fee to get your policy for you. Same thing works here. We are paid by the different insurance carriers that you end up working with if you end up working with us. Your rates are the same with us as they are if you were to go directly to the carrier. So there's no higher premiums working with a broker. That's a huge myth. You're not going to pay anymore. Every carrier sets their own rates, and each state's Department of Insurance, their DOI, has to approve those rates by the carrier. So no individual broker can get higher rates or lower rates for you than anyone else. So my rate's going to be the same as if you were to go directly to the carrier. Again, I'm an independent broker, not a captive agent. A captive agent means that they can only sell one product. Certain carriers out there, they only contract with career brokers, meaning that are career agents. They work for that one particular carrier, so they can't tell you when the competition has better plans. That's where I come into play, and that's why you want to use a broker, somebody that has a lot of tools in their toolbox. Again, it makes no difference to me whether you're with carrier A or carrier B. As long as you're on the best plan that matches your needs based on your needs analysis, then I'm happy with the plan that we're going to recommend. And if that carrier doesn't offer it, I've got others that can. And again, finally, wouldn't brokers be biased? Brokers are compensated by the carriers, and they all pay us the same amount. So there's no bias. Again, I don't care if you're with carrier A or carrier B. I just want the best coverage that's for you, because I'm looking at this as a long-term relationship. This is not just a turning 65, enroll you in a plan, and you never hear from me again. My goal is to be on this through your Medicare journey as long as you want to continue to work with me. So now that brings us to the final wrap up. You're transitioning off your employer coverage, but you're also transitioning oftentimes out of income where you've been earning and living and saving your entire life for this time frame. And now you've been in the accumulation phase, saving, putting money in 401k, 403b, whatever you might have had at work, maybe a brokerage account where you're investing in mutual funds or individual stocks. You got savings accounts, low interest CDs. You've been putting money away. You've been accumulating these assets, but now you got to spend those assets on yourself and make that money last for a lifetime. So we can help with that. We call that the safe money options. I love this saying up here at the top, at this time in your life, it's more the return of your money than the return on your money. I can't think of a worse scenario than retiring at 65 and still having your money tied up in high-risk funds, whether it's S&P or large cap funds, and the market goes down 20%. What a big kick that would be. So we look at taking some of that money. Certainly don't want to use your whole nest egg, but it's always smart to put some in some plans that provide principal protection. And what that means is you have zero chance of loss of that money. So if the S&P goes down 20%, your account goes down 0%. And then we can also focus on some of the growth factors of those plans, where maybe it's a fixed rate plan where you get a certain percentage each year, or maybe you still want to participate in those indexes while also limiting your exposure on the downside, because again, we got 100% principal protection on these, and then we can set it up so that that money is going to pay you an income for life. It's guaranteed for life. So if you're in that situation and you want that discussion, make sure you bring that up when we schedule the one-on-one consultation. So again, that brings us to the end of the seminar. We just finished step 1 is the educational seminar, and like I mentioned earlier, education is a big thing for me. I want to make sure that you're completely comfortable and understand how everything works. We can take this a step further on step 2 with that one-on-one consultation, where we're able to do a little deeper dive right into your specific situation and come up with a personalized Medicare roadmap that's specific to you. Because what's right for you might be different than what's right for your spouse or your sister or some of your friends that are giving you advice. Everybody's going to be different, and you need your own personalized roadmap. And we're going to put that together for you. We're going to put a cost summary together so you'll know what all this looks like, so there's no hidden surprises. And third and finally, if you do end up going down that road with me and you end up working with me long term, I want you to be rest assured I'm here for you for the duration. Like I said a minute ago, this is not a one-time sign up and you never hear from me again. I want you to call me. I want to be your advocate for Medicare. So if you have questions on your Medicare plans, or your plan's changing, maybe you're on a Medicare Advantage plan and it's being discontinued the next year, we got to shop that plan. Maybe you're on a Medicare supplement plan and it had a 20% rate increase. We need to shop that plan. If you have any questions on claims or billing, that's what we're here for. I want you to call me and not the insurance carrier. So one-stop shop for all your Medicare needs. If you end up working with us, that's how we do things, and that's how I've been in business for 18 years now. So again, final step. Once again, thank you for your time. I really appreciate spending this time. Hopefully that puzzle piece is put back together. But you should see a blue calendar or a link on the page that you access this webinar. Go ahead and schedule a quick consultation. I promise I won't bite. There will be zero pressure. Should take us between about 30 to 45 minutes. Again, just sort of get to know each other, see what may or may not work for you, and hopefully if we're a fit, we continue to move forward. If you feel like you've got other areas that somebody else is better for you, then we part as friends. But again, I really appreciate the opportunity, and I hope you have a wonderful day, and thank you again for your time. Take care.